More than 270,000 women live in maternity care deserts in Texas. That's according to a new report from the March of Dimes. That nonprofit works to improve the health of mothers and babies in the U.S., and researchers found more than half of Texas counties lack obstetric clinician, creating more barriers to care. So joining us now to break down this report is Dr. Mark Simon, a board-certified OBGYN and Chief Medical Officer of the OB Hospitalist Group. Dr. Simon, thanks for giving us your time and being here with us.
Thank you for having me.
So first, in this report, 52% of Texas counties, they do not have any kind of OB clinician, and that seems alarming to us. Talk to us about how that is and then how this affects births in Texas.
Yeah, so Texas has one of the highest rates of counties that don't have any OB clinicians. So that would mean they don't have an OBGYN, they don't have a certified nurse midwife, and they also don't have a family physician who provides obstetrical care. And what that means for the women in those counties is that they have to travel further in order to receive prenatal care or any care throughout their entire obstetrical journey.
And you find a lot of women don't make that extra journey just because as you're going through maternity, that is a long trip to make just to get care.
Yeah, again, the study from the March of Dimes also shows that people who live in maternity care deserts tend to drive much further, sometimes twice as much, even more than patients who don't live in a maternity care desert. And so obviously, if you're a patient who lives in one of those counties, it is just another barrier to receiving the needed care that you so deserve. And so maybe their pregnancy can be complicated by the fact that they don't receive prenatal care either at all or as often as they should.
Dr. Simon, this report also highlights an escalating threat to local care, showing that nationwide, nearly 100 labor and delivery units have closed since 2024. What is really driving those closures, in your opinion?
Yeah, I think it's a couple of factors that are really leading to that. One is reimbursement rates for hospitals or facilities in those communities that can deliver babies has not kept pace with what the costs are to deliver those babies in those communities. And additionally, what we already touched on today, it's hard to keep those types of units open if there are no providers or clinicians in those communities to provide that delivery care. So it does the hospital or the system no good to have a hospital open that does labor and delivery services if no one's there to deliver the babies. So you got to approach both of those. How do you make sure the hospital and the system is getting fairly compensated for the work they're doing? And how do you make sure there's enough obstetrical clinicians in those communities?
Let's delve deeper into that issue you just brought up. Texas also has a high rate of insurance gap among women of reproductive age here. So what is driving those gaps and what can be done to address that? What kinds of solutions are out there?
Right. So as you know, Texas is one of the states that did not expand Medicaid. So it creates an additional barrier to those patients obtaining care if they don't have if they don't have insurance before they get pregnant. Ultimately, I think it would be really important for any woman who gets pregnant and finds out they're pregnant to be able to get insurance as quickly as possible and easily as possible so that they can begin their prenatal care journey. We think about 9 months being a long time, and it certainly is when you consider other conditions, but it's also not that long of a time. And if it takes 2-3 months to get on insurance, that's 2 or 3 months that's lost in that pregnancy potentially to getting care. So allowing women who are pregnant to get on care as quickly as possible is important.
And final question here, Dr. Simon, what sorts of care models are hospitals adopting to try to fill those gaps where they can? I know it's a struggle.
Right. I think there's a few options that I've seen out there. One big one that I'm a real proponent for is how do we encourage communities to adopt more certified nurse midwifery care. We don't have a shortage of certified nurse midwives in this country currently, whereas we do have a shortage of OBGYN physicians. So how can you build communities where we have a collaborative care model led by certified nurse midwives and supported by physicians as possible to deliver that care? That will help bridge that gap, especially to women in these maternity care deserts, I think.
Such an important issue to shine a light on and let people know about this problem out there. Dr. Mark Simon with the OB Hospitalist Group, we appreciate you helping us raise awareness, and we appreciate your time.
Thank you so much for having me.